Okay, so welcome everybody. Delighted to welcome you to a webinar from NYU School of Professional Studies. I'm the academic director of the Integrated Marketing and Communications Department, where we run several programs in marketing and PR, including a newly launched certificate in healthcare marketing and communications, which we think is an important new field, obviously a growing field for those of you interested in upskilling and thinking about a broader view of marketing and PR. And I could not be more delighted to be joined today in a conversation about sort of what it takes to upskill and be successful in this area. I'm joined today by Joanna Skilling, a noticed strategist and practitioner in the agency world, supporter of many brands and a lot of really creative thinking in our industry, by Destry Solkis, who, as I often comment, is a double or triple threat with both his MD and his MBA, and as an EVP and leader in Click Health and leading data initiatives in other agencies. And Chase Feiger, who we're delighted to joins us as well, also a triple threat of sorts with his MD and degrees from Cambridge. And Chase is an entrepreneur, an investor, an advisor to many companies and sort of initiatives within the healthcare field. So we're absolutely delighted to have them all join us today. And I think and hope all of you who are able to watch this webinar will benefit from the program. We'll spend about 30 to 45 minutes with the panel and try and incorporate as many questions as possible as we go. And then we will transition to a discussion about our certificate in healthcare marketing and communications, so that you'll be able to learn a little bit more details about how you might apply, etc. And hopefully the relevance of some of the rest of the conversation. So without further ado, let me turn to Chase. Perhaps I would love to start with you and ask you, how did you get into this field, that you're currently working on? I always think no one sort of wakes up in the morning, or perhaps you did, but no one wakes up in the morning and say, I want to be a medical entrepreneur, or I've spent all this time at medical school and now I'm not going to practice, I'm going to go into business. So tell us a little bit about your journey.
I always like to say that a journey is really formed by the individuals and the mentors that I've been surrounded by. And I've been very fortunate to have had incredible mentors and other folks who have really guided me for a lot of the career decisions that I made. When I was an undergraduate at the University of Pennsylvania, I had the opportunity of working with a number of the senior leaders to the Obama administration who took on leadership roles, in particular within this world of health information technology. And that exposed me to a variety of different incredibly novel solutions around how different mobile apps that were serving as extensions to the electronic health record system, new types of technologies and other tools to improve efficiency, quality and safety of the care being provided to patients. And it was really through this experience that I noted that as a physician, that this could be an opportunity for me to have an impact on a large number of patients. And I became so excited and was able to see the impact that the technology was actually able to have also on the care being provided, that I knew this was a path for me. Through that experience, I, again, had an opportunity of working with a number of early stage VCs, the very first investors in companies like Uber, Warby Parker, among a number of other top tier, many billion-dollar technology companies. And through this work as well, I found my path as an entrepreneur and as an investor within healthcare.
Fantastic. So I love that already, that theme about sort of technology and medicine coming together and sort of how integral they are. I think that's one of the things we'll probably pick up on. Johanna, I wanted to ask you, in other conversations, some of which we've recorded together, you've spoken about your own more personal journey with your own health issues and how that's informed your work. And perhaps I wanted to build on that a little bit, is how, your experience both as a patient on a journey as we say, and as an advertising executive and a strategist, how they've come together to get you where you are today.
Oh, thanks, Michael, and thanks for inviting me to be here. It's an interesting question because, as you know, I started out in advertising after a liberal arts background, very, very different from, some of the things that Chase and Destry will talk about. And I was in classic consumer marketing. And as you said, there came a point where I had my own health issue and I had to research, and I didn't see anything that would help me. So I wound up writing not one, but 2 books on this. And as a result of that, I got really interested in the possibilities of healthcare marketing. And not as a writer, actually as a strategist, which is what my craft is in that sense. But it's all about problem solving. And it's about how do you bring people, and my first entry was patient marketing, consumer marketing. How do you bring people the information they need to make a decent decision? It's not necessarily about selling, because of course we have those restrictions, but we have the opportunity to give people a window into possibilities. And then you add the HCP part, which is how do you help HCPs develop a better understanding of patients beyond the pure clinical lens, and help them with, the power dynamic and the changing power dynamic and the changing language that consumers have and the changing needs that both bring and the empathy that both need. And it becomes a very personal, very meaningful interaction, no less from the agency point of view as sitting in the room as patient and doctor.
Just since we're early in the webinar, we'll do a quick acronym check. HCP, you mentioned HCP. What's an HCP?
Healthcare professional. So doctor, nurse, usually a doctor or a nurse. It can be a physician's assistant or a radiologist, but there's the acronym for you. Thanks for stopping me on that.
No, I think the industry is characterized by these series of acronyms. So let me turn to Destry. It's actually a good switching point, which is you're an MD, so you come already with a medical background and a scientific background. How critical do you think that is for a career in healthcare marketing and communications, and more importantly, what does it bring for you on a day-to-day basis in the field?
Yeah, thanks for asking, Michael. Thanks for having me here today. I think, interestingly enough, I think having an MD in the advertising industry is more typically a liability, actually, because physicians can come with a very specific physician point of view. And in advertising, you really need to have more of a human point of view, what people are really feeling. And as doctors, sometimes we think we're overly scientific, but in reality, we make decisions just like everyone else does with our gut. And advertising is really all about touching people on that unconscious level and really understanding what we all need to see, feel, and hear to get through our days. So I love having the MD degree because I can speak the language and speak to the scientific community and make sure I'm communicating clearly with them, but also then, like Chase said, be able to put out programs at scale that really will help whole populations and not just one patient at a time.
It sounds too like you're getting to a theme about sort of data and empathy, which we talk about in the school more generally, or the math and meaning of marketing. That there is both this scientific side in your case in healthcare, highly scientific, medical background, but there's also this, there's a human involved at all points, and the capacity to have empathy with that human. So that's a fabulous stepping off point. I wonder if I could sort of start jumping in the conversation, and I'll start with Johanna if you're okay here. In a last conversation, I think you were part of it. We were talking with Howard Quartermanch, and he brought a fact to the table which I found fascinating about the speed at which the knowledge of the industry, or the knowledge in the industry, has been changing rapidly. And my question really is about how you deal with that fast pace. I think what Howard shared, and I'll consult my notes to make sure I get it right, was that there was an article that said that estimated that the doubling time of medical knowledge in 1950 was 50 years. So every 50 years, we had twice as much knowledge as we had before. In 1980, that went up or down, however you think about it, to 7 years. And in 2010, it was 3.5 years. So in 2010, every 3.5 years, we knew twice as much as we knew before. And it's projected to be roughly 73 days now. So So how do you cope as you know, as a strategist in a world in which an industry is changing in its knowledge base twice every 73 days?
Well, I'm going to add one statistic, which is that somebody quoted last summer at a Crane's breakfast that COVID has caused the healthcare industry to cram 10 years of digital innovation into 6 months. So add that to the doubling of medical knowledge, and it's a tsunami of information. And in fact, as my course, More Than a Patient, rolls out, I find myself wanting to shove in more information, because there's so much new thinking every day. It's contributing to a bit of a knowledge drain in the industry, because you do have to have a specialty, or it helps to have a couple specialties. So what's new in oncology or rare disease or in diabetes, or what's even new with how companies are communicating to customers, and what are they doing with AI and with VR. So it's a real challenge. And my best advice to anybody coming in is to pick 2 or 3 areas to get really cognizant of and to really follow. And as they get new client assignments, or as they get jobs in different parts of the industry, hospital, what have you, that they kind of pivot there. You can't take in everything. It's impossible. And I wouldn't advocate trying.
Chase, maybe I'll build, and then I'm sure Destry will have a point of view on this as well. Chase, you're on the sort of cutting edge of a lot of the technology and the innovation, and you know, staying up to date is probably as critical a part of what you do as an advisor and an investor. So, what tools do you use, or what do you have at your fingertips to sort of stay current?
The best tool is the conversation. You know, constantly having conversations and discussions with you know, leading healthcare leaders. You know, it's very important for me to stay up to date around the latest pains that the industry is experiencing, from conversations with CEOs of big health systems, executives across pharmaceutical companies, medical technology companies, medical device companies, and conversations with folks like Destry, to really make sure that I've got a good finger on the pulse of exactly how these organizations are thinking about the future, and how they're positioning themselves and the current pains that they're experiencing to really build technology solutions that are solving for something real rather than solving for something that's cool or interesting. That's always very important. In addition to that, you know, again, always maintaining open lines of communication with healthcare policy leaders, who, of course, understand some of the regulatory changes that are coming down the pipe, as many of these regulatory changes will strongly impact the decisions that these organizations will have when it comes down to embracing new types of technologies and solutions that lie in front of them. I think there's 2 great examples. Let's look at the example of telemedicine, and let's look at the example of remote patient monitoring. And I'll give a more specific definition of what that actually means. In the case of telemedicine, we saw, you know, this past year, we've seen more telemedicine visits than we ever have in the history of our nation. Telemedicine became a new vehicle for virtual care that allowed for us to safely treat patients while maintaining and really controlling for the overflow of hospitals and healthcare practices. It's provided and been used as an efficiency tool for many doctors, physician assistants, nurse practitioners, among many others. It has really been something that has, quote unquote, saved us as a healthcare system, and really has had just a significant amount of impact on the lives of many who have remained susceptible to diseases like COVID-19. Again, these types of technologies around telemedicine would not have been possible if it was not for the regulatory changes occurring on a state-by-state basis, as well as regulatory changes occurring on a federal basis by enabling physicians and others to practice across state lines. So again, these regulatory changes are absolutely essential when we think about technology development, innovation, and the impact these things can have across organizations in the healthcare value chain. The second piece around remote patient monitoring. Now, for many years, a lot of healthcare leaders have said that, and they've been considered the contrarian thinkers. They've said that doctors will act like engineers, and there will always be a human component to medicine, but that there's so much data being gathered by new types of wearable technologies and solutions that can allow for doctors to remotely monitor patients, even when they're not in the office, i.e., you have this snapshot every year around how a patient is doing. You're collecting labs on that patient, but between each of those annual visits, there's a blind spot. Remote patient monitoring and the different technologies that enable remote patient monitoring really solves for that. And that would not have been possible as well if it had not been for some of the regulatory changes that that have been made specifically with Medicare to allow for that. So again, that's why I say it's having those conversations, maintaining those open lines of communication. This is how I constantly learn. Of course, I'm reading tech blogs. I'm keeping up to date with relevant technologies and solutions that have been successfully applied in other industries outside of healthcare to see exactly how those solutions could apply to our industry.
I think there's some real wisdom in there, Chase, about avoiding the bright, shiny objects, and Des, you maybe, I don't know if you had some thoughts on that, or we can transition to another question, but how do you do that to some extent, avoid the bright, shiny object but stay focused on the things that really matter?
I think I would say it's just by getting out and doing things, experiencing telemedicine, for example. Like I've scheduled all of my visits this past year by telemedicine, saw 3 new doctors, 3 different systems of how they worked, one through Sinai, one through Doxy.me, and one through ZocDoc. And just by actually going and doing these things, you see what's happening to, all the people in the country that are having to learn new technologies and experience new channels.
Yeah, I think we can all we all resonate with that. Every time I visit the doctor, I think electronic patient health records can't come soon enough. When I'm asked that question. Desi, I had a question. I'm familiar with some of the work you're doing, and probably the work that a lot of people interested in a degree like this or a certificate like this would be, which is about sort of, in some senses, public health. And we've got a public health crisis right now, and the importance of information and communication is absolutely critical. And my question really is at the end of all that is often changing behavior. Yeah. So the idea is, ideally we want you to take the vaccine or wear the mask or, continue with your prescription or whatever it is. What have you learned, you think, as a marketer and a communicator about how advertising and marketing can do that, how you help change behavior?
Well, I'll put in a little plug for my course, the foundational course, which is really helping people in the ad industry understand how healthcare system works. Because it's actually pretty hard to understand if you don't get some formal training in terms of how the money flows. So, why do we have health insurance companies, and who do they actually pay? And who actually pays the drug company to develop the drug versus pays the doctor to provide the care? And what perverse incentives are there in place that maybe the public doesn't really know about? And so in my course, I get to address some of these things so that when we go then to develop communication programs for the public, we know what we're trying to get them to do. That's maybe not just talk to their doctor, but it's really own their own healthcare journey themselves and feel more empowered to do things that are meaningful for them. You're on mute.
I love that idea about the journey. I think this sense of patient advocacy, and perhaps we can come back to Johanna on that, which is really, I think, probably a central question, that draws a lot of people into the field, is for many of us, or is an advocacy and a feeling of engagement with our own issues or the issues we see around us. But any observation you've had about, or things you've seen that you thought were very powerful, like really had some impact on the way we all behaved and for the better of society, if I'm not sounding too grandiloquent,
Well, there are some amazing things that are changing. I mean, after 9/11, all of our behavior changed. We took off our shoes before we got on airplanes. Everywhere in New York, you now give your name and show an ID, where you never had to do that before. COVID is changing. How many times have all of us washed our hands today, let alone this week? And you mentioned wearing a mask. One of the things I'd build on what Destry said, which I love, is the idea of cognitive biases. So in terms of changing behavior, what are the ways to tap into these very deep unconscious ways we think? And my colleagues at Ogilvy have done amazing work in this area. And I'm going to follow Destry's lead and put in a shameless plug for my class as well, where we dive into that a little bit because it's a huge field. But when you look at campaigns that really move the needle on behavior change, I can give you one fabulous example about stopping smoking. It tapped into something people don't even know is a problem. The Thai government, public health issue, wanted to help people stop smoking. It's a giant issue in Thailand, even more so than in the US. And the strategy they came up with, and again, I want to give credit to my Ogilvy colleagues, this was a few years ago, they filmed a spot, almost like a documentary, where they had small children asking strangers on the street for a light. And the adults were appalled. And they said, "You're too young, what are you doing?" And the child said, "You did it." And it caused a massive rethink and a 40% increase in calls to the public health smoking cessation center. So in addition to the logistics of the way things work, which I agree is critical, there's the software in our heads. How do we decode that?
I love that insight, actually, which is about not forgetting what we call the affect, and the emotion, and how you appeal to people beyond reason. I've spoken with for those for whom this webinar is not contemporaneous, so to speak. You're watching it later or at a different point in time. We're speaking to you as the first wave of vaccines have been launched around the country, and a couple of weeks after the inauguration in 2021. And one of the most powerful things I experienced on the day of the inauguration was the poetry of Amanda Gorman, and of the many words spoken up on that dais, perhaps the poetry and that sort of more emotional use of language proved to be the more powerful. So I'm going to actually sort of punt this back to Destry, perhaps, sorry, to Chase, if you don't mind, Chase. And somewhere in there you may have a degree in literature or poetry, I don't know as well, but you obviously sort of to some extent come at a lot of these medical or healthcare issues from a data and a technology perspective. But what are you starting to see in their field about how people either in their invention of new technologies or new medicines, new devices, whatever, or sort of how they talk about them, how are they building back into this sort of data and empathy and a broader appreciation for who we've got to convince and how?
It's a very good question. It's a very, very good question. First and foremost, I think it's very important for us to remember that every data point is a human being. Every time we're interacting with mass amounts of data, when you see that, when you see 50,000 data points within a healthcare system, 50,000, have this chronic degenerative disease for, like congestive heart, CHF or some other underlying pulmonary disease. Every single one of these numbers in the data sets is a human being. And I think it's very important. Like sometimes, I have to admit, I will lose that sense when I'm looking at mass amounts of data. And it's really important for individuals to be willing to admit that, to be vulnerable of that fact, and to just constantly remember that every single one of the data points across these massive data sets are human lives that are being affected in some way, shape, or form by the technology that's being developed. So that when you're running a clinical trial and you're working across tens of thousands of people, like in the case of the most recent trial done by Pfizer and Moderna, every single one of these numbers, when we're looking at side effects, the side effect profiles of new types of medications, and in this case, vaccine-based therapeutics, again, these are lives, and we constantly need to strive and, of course, leverage the data as a way of determining statistical significance and validity across a large population size. But we need to remember that empathy should always be embedded within these data sets. And the way to do that is just to remember you're dealing with lives.
Actually, is that a good way to sort of think about it from the advertising and marketing perspective as well? I mean, when if you're pitching some new business for a healthcare company or a pharma brand, how do the executives there, take us into that sort of room, where you're pitching something? What typically are you talking to the chief medical officer and the chief scientific officer? Or are you purely talking to the marketing people? And what's the language that you're speaking? What's the language they want to hear? I think you're on mute again.
It's certainly evolved over the years, and I think we're in a really interesting time where most of the heads of marketing at the healthcare companies we work with are very consumer oriented. So they look very much to the Apples, the Nikes, the brands that really resonate and have an emotional tie to each of us as the goal. Like, how do we become a brand that has that kind of relationship? And teaching this group of, I'll call them healthcare executives, the limitations of that, but also the possibilities is really what's happening right now in the advertising world. Because certainly we can't necessarily think about our heart medication the same way we think about our iPhone. And yet there are some similarities in the pure brand itself and what the brand can do for us and the relationship we want to have with that brand, and even the brand's relationship to our loved ones. So how are we, for example, like when I took my mother-in-law to get the vaccine and I saw the Moderna vial there, I certainly had a relationship to that. And I think those are the things that we're trying to shape nowadays.
Yeah, that's a really fascinating observation. How do you capture the kinds of connections we have to things like iPhones, which are both ubiquitous, but also, quite central in our lives? And yet medicine is not an iPhone, yet medicine is something much more significant. That's a fascinating observation. I'm going to sort of move into the territory of some questions that we had coming in from folks who were interested in specifics about the career, and maybe I'll start with Joanna, a sort of a more general question. And we started to pick up on some of these themes, but what would you say are some of the core skills that emerging professionals need when they're trying to enter this industry? And especially if you think they're somewhat distinct for healthcare, pharma, etc., that you found different from other parts of the industry, the advertising marketing industry.
Well, you almost hinted at it earlier. There is a bias inside healthcare that the language is different. And there's a bias among some that you've never worked in oncology, you can't work in oncology because it's too complicated, which I absolutely fundamentally disagree with. And I believe I'm proof of that. But it will pay to read the literature and understand the terms, because it is like going into a slightly different country where people do talk differently. So that's part one. I think Destry's point about understanding in the US a ridiculously convoluted payer-oriented healthcare system is vital, because that's how brands come to market. And I do think the third thing is that influence of consumer marketing, consumer brands on healthcare is vital, partly because brands like Peloton, Amazon, Apple are all encroaching on some traditional pharma biotech device areas. And so that's a big competitive threat. That plus behavior change, that plus all the innovations you talked about sooner. But I think if people start with what's the language, what's the system, and how can I really think about new ways to bring consumer ideas to pharma, those would be my starting points.
Yeah, maybe I'll throw this to Chase, because I think what I've found interesting in my conversation with you, Chase, and I know you're teaching in your class, is seeing some of these disruptions and changes as opportunities as well. Like where are these spaces being opened up? And how do you think, let's assume we've got a group of younger or emerging professionals in the field who are interested in sharpening their skills. Obviously, we're going to tell them to take the certificate and take a class with you, but more generally, what's your sensing to figure out how to make sense of some of those opportunities? How do you leverage what I think for many people is considered restrictive, lots of regulations, lots of rules that you can break, etc., or you don't want to break, is my point. But you're still looking for sort of the important opportunities to build better products, tell better stories, etc.
My advice is use it as a guide. Use it as a guide that you have to strictly abide by, but use it as a guide. Many of these regulatory changes that are taking place on a policy level open up massive opportunities for entrepreneurs, as well as early stage investors who are, creating and are partaking in this journey of creative disruption within healthcare. Again, by you always want to make sure that you're, of course, playing by the rules and following the rules. And a way to do that is, bringing on the right expertise from a legal as well as regulatory perspective. You can even call, I always tell people this, you can literally call the FDA and have a conversation with folks at the FDA when you have a question about something. Many people don't realize that. It takes time and investment, but it's actually been another way that I've learned tremendous amounts. And it's usually the advice I give to VCs and other early stage entrepreneurs. To Johanna's point, she mentioned companies like Apple and Amazon and others who are now, repositioning themselves towards this last frontier. I refer to healthcare, by the way, as the last frontier of innovation. Now, we've seen the mass consumerization of so many other industries, from logistics, transportation, video, food delivery, and the list goes on in terms of how we've seen these types of these things applied. And many of the most successful companies, whether you look at consumerization of health companies like Roman or Hims or others, even within the space, they're bringing in best-in-class brand brand and marketing leaders, like Destry and Johanna, who have extensive experience knowing how to knowing exactly how to facilitate this, on a large company basis. And then they're also relying on key regulators and other folks that have had and spent years of experience working within, even within the FDA, other government organizations within the Department of Health and Human Services, and then, of course, even taken on commercial regulation roles at pharmaceutical companies. Again, use it as a guide because it's a guide to opportunity. And these should not be intimidating. They should be embraced. Entrepreneurs need to remember, like, this creates, it's a natural moat. I mean, just remember the fact that it's hard, the fact that these policies are there means that you're likely going to have fewer competitors, and there is opportunities to really build large, disruptive, and impactful companies within the space.
I love that idea. I think Scott Galloway and others at NYU would say education may also be the last frontier of innovation as well, right up there with healthcare. But and I hope, what we offer, I'd like to believe, we've really tried to be more innovative in the way this certificate is offered, including bringing the three of you into its design. It is very much the mission of NYU SPS is this idea of transformative learning experiences in real world applications. And I honestly, genuinely can't think of a better example of having the three of you, intimately involved in the design of and the delivery of this certificate. Destry, I'm going to sort of pivot perhaps to the last formal set of questions to the question that's always on most people's minds who attend these webinars or write to us, which is, how do I get a job? How do I, what's my path in? So maybe take, broadly between the three of you, we'll start with Destry, take sort of two personas. One, a person perhaps who's out of undergraduate, done a couple of years work, etc., maybe interested in marketing, but wants to get into healthcare marketing. And then the other persona might be somebody, who perhaps worked in healthcare as a nurse or a practitioner or something, took some time off of work and is now returning to the field, and I know that's to some extent the profile of the students you've already had, Destry. So thoughts about how they get into the industry, once they got their certificate, of course, but thoughts of where you start. So.
Yeah, sure. And those are absolutely the two personas that I've seen most of my class. And interestingly, at my agency, we actually are sending some of our younger staff through these courses specifically to broaden their foundation in healthcare, to make sure they really are up to speed, to Chase's point, when they're coming into the space, not running headlong into the regulations, but actually understanding where they are so they can run really close to them, but stay on the right side of the rules. So the younger people, I think it helps them immediately upskill, get interviews. We actually have agencies coming to my office hours that are presenting, what they have on offer for internships and things like that. And then on the other end of the spectrum, the other persona, the more experienced folks, really interestingly, they bring a lot to the class, number one, because they've had a lifetime of experience in some other field, and they're looking to really enter a new field in healthcare at a higher level. So they're not really at the beginning phase of things, but they've got some really solid skills already in, say, health insurance or the hospital administration, but they really now want to learn how to market. So both groups seem to be getting a lot out of the course.
And Johanna, your sense of what is actually out there in the world for jobs, and I mean, we like to say that healthcare generally is the fastest growing industry, clearly, but we know too that a lot of that is in more medical specific or consumer facing type roles, or home health care and things like that. What's your sense of the landscape? If you're I want to be ad exec or strategist or PR maven in this area, do you see companies hiring, and where should people be looking?
Michael, it's incredible to me. Companies are desperate for talent, especially mid-level. So people taking the course, regardless of if they're that new student or a changing student, they're not absolute beginners. They're not seasoned senior requiring a ton of investment by the company. There's a dearth of talent in account, in strategy, in creative that is going begging. And I was in that position. I was 4 years into my career when I took the SPS class in integrated marketing many moons ago. And I networked my way into a company that at that time was called Wunderman, Ricotta and Klein, and is now Wunderman Thompson Health. And that is the advice I give everybody. Use your school network, use your LinkedIn network, go for informational interviews. Don't worry about getting the job, worry about building your network and saying, who else should I talk to?
Fantastic, counsel. I think we're going to give Chase the last word on this, and then we'll do a pause, basically, folks, and we'll transition to some discussions about the certificate. So, Chase, any sort of concluding thoughts about getting a career and chasing the brass ring, as they say, in healthcare and marketing? Healthcare marketing.
Well, first and foremost, I'll just disclose the fact that I always get made fun of for being told I've never actually applied for and ever worked a real job in my life. But all jokes aside, from my experience recruiting and interacting with new types of talent, I'll just kind of relay some of the points that Johanna had made just a second ago, which is always get ahead of the curve, right? If there's something that you're very passionate about, my advice is start building relationships as soon as possible with the leaders in that area. Never be intimidated. You would be so surprised as to how many leaders at major companies and other organizations want to help. They want to help. They've been in your shoes before. They've been in a boat where they are dealing with the psychosocial stress factors associated with finding a job. They have the same anxiety, the same stress. Every single one of us has. I've had it. Everyone has it. So it's reach out, ask for help, schedule a virtual coffee with somebody. We live in a time where you're able to access really anyone by leveraging platforms like LinkedIn, by leveraging platforms like Zoom, by picking up the phone. And by, of course, when you walk into the conversation, my advice is know who you're talking to. Find a way to be helpful to that individual. Show that you've done a sufficient amount of research and diligence. Don't walk in empty-handed. Don't walk in unprepared, because it's not going to reflect positively on you. And ultimately, at the end of the day, follow your passion and follow your heart. If in life you're doing what you love, it's so short. You got to do what you love in life. And if you don't love it, your career is going to be the aspect of your life that takes up a majority of what you do. And so love it. Don't do it for the money. Don't do it for some other type of superficial reason. Good things will follow. do what you love. And if you don't know what you love yet, try a bunch of things, have a bunch of conversations. Even I don't know what I'm going to do with my life at this point. I'm serious. I say that laughingly, but I'm serious. How do I know what I'm going to be interested in 10 years, 15 years, 5 years, 20 years? Nobody does. So just have a lot of conversations with interesting people and walk in prepared. Again, leverage the tools in front of you and you'll find your next step.
Fantastic. Well, that's great counsel to end on. And I think I'm hoping these last 35, 40 plus minutes will add to the stock of people's knowledge and level of preparedness as they venture out. And I would, of course, add that you should always invest in yourself, invest in your education, keep learning, etc. And the certificate provides a wonderful opportunity. So on behalf of NYU School of Professional Studies, I want to thank all three of you. It's always a pleasure and a delight. It's probably the highlight of my day when I get to have these kind of conversations. So we're going to probably, hit literal pause for a second. Matt, if you're... So welcome back to those who joined us for the first part of the conversation with Destry, Chase, and Johanna. Thank you for Destry and Chase who were able to stay on. We want to talk a bit more specifically about the certificate that the school is offering right now. And so I'll take you through some background to the certificate, and I'll ask Chase and Destry perhaps along the way, along with Kate Entz, who's here with us today and an important person for anyone interested in the certificate to know. So the healthcare sector, as we've said, and as most people, if you read even casually in the newspapers, is one of the most rapidly growing and arguably dynamic sectors in the industry, in the country today. And that was true prior to the pandemic as well. The number of jobs being created, even specifically in the tri-state area, is probably shows the greatest growth in this field. Glassdoor, which tracks these kind of things, said there were over 1 million openings in healthcare and biotech and pharma. Many of those, are either in the labs or in medical offices or hospitals, etc. But as the industry grows generally, the need for communications and marketing professionals is greater. The second thing I think which makes this certificate such an important offering is that for anyone who works in and around the space, you'll know that the demands of what is a very highly regulated industry and an industry which touches in very profound and personal ways each of us as individuals and our healthcare, our family's healthcare, etc. It is a marketing and communications challenge that demands some unique capacities and knowledge and background, etc. So it requires some learning, it requires an investment in some knowledge and skills, etc. The third thing is that it's an area, like most things in our society, that's being rapidly driven by digital and data. And for those of you who participated in the earlier part of the conversation, I think Chase made the point about innovation and medical and healthcare being one of the last frontiers of innovation. So there's most rapid, there's a lot of and a lot of significant changes coming out of digital and data, requiring all of us as marketers and communicators to sort of keep freshening the skills and polishing up our knowledge about what's going on and working through in classroom settings, etc., how to react, how to respond, what's best practice. And finally, it is clearly true for those folks who come at this with more limited marketing skills, for example. So many people interested in the certificate have come out of the healthcare and medical professions themselves, but have had less specific marketing training. This certificate is designed to give you those fundamentals too. So these are sort of four main reasons. The new certificate we soft launched in the first semester, and we have a full range of programming going now. And it really is built, I should say, directly with the input of leading thinkers and doers in the industry, like Chase and Johanna and Destry and Margie Kuo from Pfizer and folks from J&J, and really, people who have been steeped in this industry for many years, what you'll get, what we hope the outcomes that you'll benefit from are first to really come away with a better understanding and evaluation of all the various interrelated roles that you find in an industry. It's certainly one where there are lots of different players at lots of different levels within the ecosystem. And to some extent, it can be a bit, overwhelming when you first encounter it. But I think our instructors have done a really nice job of simplifying that complexity and identifying what matters, what relationships are important, etc. The second is really to look at that quite unique and often quite long process through which medical devices, healthcare technologies, pharmaceuticals, etc., are developed, are productized, are marketed, are sometimes then retired. And so there's a lot of life cycle marketing in the field of healthcare, and we look at those issues. The third thing I'd bring some attention to is the fact that, as we mentioned, there are some very unique challenges, and folks on the earlier panel spoke about seeing them not just as challenges but also opportunities. But they clearly are sort of the land. I don't want to say landmines because that's not fair, but they're sort of the curves in the road you need to know about. And then the whole thing is really around this idea of designing integrated marketing and communications programming. This is not a theoretical certificate in any sense. This is really to help you get equipped so you can go off and build marketing plans, communications plans, advertising campaigns, etc. And finally, I think, which is a watchword for all marketing and comms efforts these days, is to make sure that you're closely aligned with the business needs of whether it's an agency and its clients, or a pharma company, or a hospital, or a large medical practice, wherever you end up situating yourself in this industry, marketers and communicators increasingly, arguably always, need to have their goals and activities aligned with the business goals. So these 5 sort of broad outcomes are what we're aiming for. So I'm going to actually ask Destry if he'll give us some sense of the specifics on the left side, but just as the broadest introduction, to do the certificate, to complete fully the certificate and be awarded the full certificate, you need to do 2 foundation courses and then select 2 from the electives. Obviously, you can do individual courses. We don't discourage that, but the full certificate, to receive that certificate from NYU, accredited by us, you need to do the 2 foundation courses and then 2 of the electives. So, Desi, give us some sense of what's included in the 2 foundation courses, if you wouldn't mind.
Sure, Michael. The first 2 courses are really designed as a pair, where the first one is the healthcare system itself, meaning the 4 key players being providers of care, the payers who pay for that care, the manufacturers of the medical devices and pharmaceutical products that are used during care, and last is this big bucket called innovators. So we look at how the money flows amongst them and how the system works and how healthcare is delivered. And as the culmination of that 7-week course, we actually teach you how to write a request for a proposal. So one of these organizations, either a manufacturer of drugs or a hospital or a health insurance company, when they hire a new marketing agency, they go select 3 or 4 agencies to choose from, and they give them all a request for a proposal, which outlines their business needs and what kind of marketing strategy they need. So that's the culmination of course 1. In course 2, we actually take you through the entire brand development process, from looking at patient journeys as they go through the healthcare system, researching on a primary research level into what emotions they're feeling as they make decisions about which healthcare products to use, and then ultimately developing a brand strategy, a brand plan, and a creative brief that will result in a brand essence. And the culmination of course 2 is to actually create a pitch. So you act as if you're the agency going in to a drug company and pitching a drug company on creating a brand for a new product. So those 2 courses are essential to then lead into the electives.
Fantastic. And as you can see, we have a number of electives which cover the range from things like data-driven analytics, following the patient journey, which is, a very hot topic in marketing generally, this notion of customer journeys, but even more critical in marketing to patients. And we have this wonderful course around disruption and innovation. So, want to invite Chase, since he developed the course and will be teaching that, to comment about what he's hoping to achieve and what he hopes students will take away from his course.
Thank you, Michael. Yeah, the Disruption and Innovation course's goal is to give students an opportunity to become the innovators and to actually take the time to understand the process upon how innovation is done. So, oftentimes there's a lot of intimidation when going through innovation at a very large institution, or whether you're an intrapreneur, or whether you're an entrepreneur creating outside of an organization and trying to build your own disruptive health technology solution. So what I do in this course is I bring simplicity to the process, map out the journey around how successful entrepreneurs do this. You'll have an opportunity to hear from leading entrepreneurs and innovators, such as those who have built many billion-dollar companies across the consumerization of healthcare. You'll have an opportunity to hear from internal senior executives who run innovation groups at large multinational healthcare companies across the pharmaceutical manufacturing space, as well as medical device space. And this course, again, the end of it will actually involve you putting together a pitch to create your own innovative solution for both either that be a large, a very, very large, acting as the director of innovation or the head of marketing innovation at one of these companies, or give you an opportunity to pitch a round of VCs for a new idea that you have.
Fantastic. So, really an advanced opportunity, and perhaps some of the professionals interested in this will be those who already perhaps have some ideas that they want to develop, with your support and tutelage. Be a great opportunity for those on this call or those interested in the certificate who come already perhaps with some business ideas. Then I think Chase's course would be a fabulous opportunity. So, all right, let's look a little bit more at the mechanics, and I'm going to ask Kate if she would help us there. There's obviously, like all things these days, lots of information online, but we also want to make sure you know how to reach us in person. So Kate, talk us through this a little bit.
I'm Caitlin Enns, and I'm the program administrator. So I'm your main contact person should you have any questions. And we'll be sending a follow-up email with all these details as well, so don't worry if you don't get it down. But so our program, as Michael said, is a certificate, and it's made up of 2 foundations and 2 electives if you want to complete the entire certificate. All of these courses are online asynchronous, which means there are not times that you have to log in regularly. It's asynchronous. They're still very interactive though, so there's lots of speaking with your classmates. There's also checking in regularly with your faculty members. So there's a lot of checking in, following through, and coming up with work products that you're able to use in real life situations. If you're interested in learning more about the program, you can reach out to me at sps.marketing.pr@nyu.edu, and I'm happy to answer any questions. I can also put you in contact with any of the faculty members who are happy to answer content questions or share a syllabus with you. And we wanted to mention also that there are many benefits to joining the certificate. You can network with different classmates and your instructors, but also you have access to NYU libraries, which is an amazing resource as a certificate student. You also get invitations to NYU SPS events, and you receive a discount of 10% per course when you enroll in the certificate program. So to do that, all you need to do is declare your certificate candidacy. It's a simple form that needs to be completed, and we will also share that with you, and we can answer any questions that you might have about that as well.
And the links, etc., we'll send around where and provide those. If this recording will be posted on our YouTube channel probably, and possibly on the website too, we can provide the link. So one other thing I would say, I'm not sure if we mentioned it here, is we have a certain number of accreditations already, professional accreditations, meaning if you're a member of some groups, Healthcare Managers, I believe, Association, and some others, where the certificate and the courses count for continuing ed hours. So I want to encourage those folks who are either starting down that path with their association or feel that might be an added benefit to know about that. And there is more information on the website too. So Okay, I think that's our, that's sort of a wrap. I can't, I want to just thank all of you who joined. This is a less interactive session than we originally planned, but wanted to make sure everybody had a chance to get the information in a timely way. And so please reach out. You see the emails up here. And as Kate said, she's your perfect conduit to getting to any one of us. And I think it probably just behooves me to thank everyone who joined today, including Destry and Chase, who stayed on with us, and my colleagues Matt Blon and Kate Entz for pulling this together. So many thanks indeed.